So we're quickly trying to look at the next concept in what gynecology. This is what is known as the embryo transfer. Embryo transfer. So for the embryo transfer, it's just a final and crucial step if fertilization was done outside. So they collected the sperm, they collected the eggs, they fertilized them outside. Do you understand? So there's a stage where they have to now what? Get it to be implanted into the uterus. So that's the embryo transfer stage. Alright. So this is where a fertilized egg, embryo, fertilization was done outside. Okay. So it's placed into the uterus with the hope that it will implant and pregnancy will start. So what is involved? A catheter is used to gently insert the embryo through the cervix into the uterus. Typically done 3 to 5 days after egg retrieval. Do you understand? So they fertilize the egg outside, they make sure that it starts growing, start dividing before they transfer it. So the procedure is quick and usually painless, often compared to pap smear. Like the pain, it's painless compared to pap smear. So types of this embryo transfer is fresh transfer within 3 to 5 days, frozen transfer. This one, eggs are frozen, then transferred in a later cycle. And embryos are frozen, like the fertilization went on, but they froze it till later. Blastocyst transfer. This one, eggs are cultured between 5 to 6 days. So from 5 to 6 days, if you have done embryology, they have become a blastocyst. Okay. Single embryo transfer. So when embryo is transferred to reduce risks of multiple pregnancies. So multiple embryo transfer, more than one embryo is transferred, increasing chances, but also risks of developing twins, which is nice though. So when is it needed? If natural conception is difficult, maybe the woman has ovulation disorders, the fallopian tube is damaged, endometriosis, we come into this. There are genetic concerns or the male is infertile. Alright, so previous in vitro fertilization have failed or the embryo were frozen for future use. Success rates and considerations depend on the embryo quality. Alright, uterine receptivity and parental age. Okay, so blastocyst transfer may offer higher implantation rates, but fewer embryos survive to that stage. Okay, so risks include multiple pregnancies, miscarriage, preterm birth, especially with multiple embryo transfer to the mother.